Tim, thank you so much, and thank you, panelists. Another fascinating day. So hard to believe, but this is now the final session, the roundtable that's going to look at the future. We started with a historic perspective yesterday, but now we're looking forward. So this is a session that we will work together to envision a public health preparedness and response system that can equitably manage infodemics in the future, while also building trust in the system's response to a public health emergency. And I have the great pleasure of moderating this panel with 5 experts, and I'm delighted to welcome them. So first, Michael Fraser, who's CEO of the Association of State and Territorial Health Officials, ASTHO. Mike has been on the ground throughout the pandemic and well before, working state by state to coordinate responses, so it's great to have him. William Hallman. Bill is a professor and chair at Rutgers Global Health Institute. Bill also served as chair of another related National Academies workshop just held last month in March, having to do with health communications by the federal government. So we're going to be hearing more about that in just a second. Bruce Lee from the City University of New York Graduate School of Public Health and senior contributor at Forbes. He's a member of our planning committee for this workshop, and he brings a systems perspective to this conversation. You've also already met Jewel Mullen from the University of Texas at Austin Dell Medical School. She's a member of our planning committee, and she brings both a state and federal public health perspective. And then Demetre Daskalakis, who has been the deputy coordinator in the White House for the national Mpox response, and we thank him for his service as well. So for the next hour, I'd like to invite the roundtable to think about the rich content that's been shared over the last 2 days about actions, about practices, capacities, capabilities, partnerships at multiple levels. Now, we've heard, especially today, a lot of attention to the fact that an effective response starts with intentional preparation when there is no emergency. We need to build capacity within public health departments at the state and local level, especially since every state is so different. We need pro-health policies that support and fund public health in times of quiet to get ready for the future, and lots of emphasis today on connecting with the community and engaging with the community. So those were great themes from today. So let's divide this discussion into 2 time frames. For the first half of this roundtable, let's just think about the short-term and immediate-term future. Let's say the next 3 to 5 years. What are the top actions that we can all take within the current system and structures to support more resilience in the face of an infodemic through a public health emergency and build public trust? What needs to be done, and importantly, who needs to do it? So I'd like to suggest that we start with Bill, and I'd like to ask him to speak for about 5 minutes, because last month Bill chaired a related National Academies workshop entitled Effective Health Communications Within the Current Information Environment and the Role of the Federal Government. So Bill, of the needed federal agency capacities and capabilities you identified at that workshop, how can they be linked to agencies at the state, local, tribal, and territorial levels? And thank you for your service in chairing that.
My pleasure. So to address your primary question about, what do we need to do and who needs to do it? One of the things that we identified is the need to embed effective communications considerations into every aspect and at every level of public health. We noted that effective communications doesn't simply come at the end of public health decision-making, but is in fact essential to decision-making, which means that people with communications experience need to be at the table at all levels and at all times. For that to happen, we need to hire and support professionals with expertise and experience in the science of risk, health and science communication, and especially those with backgrounds in the social sciences. I'm a psychologist by training, for example, but also colleagues with experience in communications and in responsible science journalism, as was pointed out in the last session. One of the things that we emphasized is that effective communications can't simply be a side job for health professionals without this experience and expertise. And also that, while useful, an afternoon spent on how to refine messages isn't sufficient training. Many of us do that kind of training, and that's great. But unfortunately, the most difficult skills to learn to be an effective health communicator is how to listen, how to understand people's perspectives and their underlying concerns, irrespective of what it is that they're actually saying. So what are the key issues that underlie that, and how to connect with shared values? And that takes a lot of experience and a lot of practice, more than one can accomplish in an afternoon. Many of us tend to be trained in another area and to rely on our intuitions in working in communications. But I want to emphasize that there really is a science of this, and that there are people who are being trained in this who can come and occupy essential positions in public health. The third thing that we talked about was our need to improve our abilities to communicate rapidly under conditions of uncertainty. So this is what we know now. Here's what we don't know. Here's why that's important. But given the best available science, this is our current recommendation, and setting up the expectations that new information is going to be forthcoming and may change our future guidance, and then sort of ending with this is how and when we will communicate in the future. We noted, but particularly at the federal level, but at the state level as well, being able to communicate rapidly is a huge problem. There are too many layers of approval, too many legal aspects, shall we say, concerns about liability in talking too quickly and not being absolutely on point. The fourth thing is we need to obviously value and support community engagement. We've heard that a lot over the last 2 days. Absolutely. We also heard that engagement needs to begin with working together on public issues of concern to individual communities, so bottom up, rather than being driven exclusively by the priorities of public health authorities, so rather than top down. And the question is, how do we create structures that allow communities to approach us with their concerns rather than us always approaching the communities? And while community engagement is critical, we also need to engage other institutions that have the ability to amplify public health messages and to act on them. We've heard about engaging with healthcare providers. We've talked a little bit about professional medical associations. That's important. But also social media providers, local media. We heard about local radio and the importance in Indigenous communities, connecting with universities. But I want to add that we also need to connect with businesses who have the ability to act, to carry out public health advice, and also marketers of relevant products. One of the things we didn't do very well during COVID is to connect with those who have very large marketing budgets who were selling products related to the ability to have people take action against COVID. I don't think we did a very good job of engaging them. And then in the short term, we also need to engage in better targeted messaging to key audiences and to monitor the effectiveness of our efforts. We did hear some about that in the last 2 days. I think that's really important. But we also need to consider how we're framing that monitoring and the ethical and political consequences of doing so. If you think that people are upset about you asking them to, or encouraging them to get vaccinated, once opposition parties begin to understand that you're actually monitoring social media to figure out how they think, you'd better have some responsible ways of kind of framing that. So that's the short term. Would you like to hear the long term, or would you like to have that as a separate question, Howard?
Let's just have your panelists react to.
All right.
So we're sticking to the short term. So let's hear from our other 4 panelists. You can just react to Bill's little report and just give us the top few actions that we can do in the next 3 to 5 years to build a better system. So Mike, do you want to start?
Yeah, I mean, thanks, Howard, and what a great event. I got to tell you, I'm blown away and actually almost paralyzed listening to all of this. But I can tell you, based on Bill's comments, I would agree wholeheartedly. But I would start with community. I mean, I think that's where there's just so much opportunity, especially coming from governmental public health. The opportunity to kind of to listen, which is, again, something that a lot of governmental public health agencies don't do well, honestly. It's something that we need to do better. And so certainly that's where I would start. I think there's a huge, just asymmetrical threat here. I mean, people talk about this a lot. And governmental public health is not going to be able to solve this problem. It's just out of scope. With the resources and competencies and capabilities. So it's really gonna depend on the kinds of folks that you brought together in this workshop to work with governmental public health to get those messages out. And so, for me, it's really, again, starting with community, realizing that it's an asymmetrical threat and something that we have just really great need to partner with others in business, in university settings, and not in government. I mean, if you want to know the capability of a governmental public health agency to respond to any of this, just go look at their websites. I mean, it's not a good example of state-of-the-art technology. So we're going to have to go outside. And honestly, I think there's a real need for some foundational conversation about scientific integrity, and again, sort of reestablishing what that looks like, and always having that as our touch point in governmental public health. And to the point that was made earlier about some health officers who may be lacking in that area, again, that's something that we are dealing with in these increasingly political times, and it's an issue that we have to address. So those would be my sort of off the cuff remarks, Howard.
Mike, thanks so much for starting us off. And again, thank you for your service, man. You've been amazing over the last 3.5 years plus.
Thank you.
Bruce, you want to go next? Give us your top couple of recommended actions for the next several years.
Yeah, thanks, Howard, and thanks to everyone who participated in this workshop. We've seen just a wealth of information and insights. I think first and foremost, and it's starting with this workshop, this really needs to be much more of a priority. So if you've looked over the past, decades, we've heard from many panelists how it's sort of been, a side thing, maybe a hobby, maybe something that you do in addition to like the main work, but that doesn't work. So if you look at, for instance, most companies, whenever a company launches a product or service, the amount of effort and resources that go into communicating, to understanding the market, to setting up an advertising campaign, to then like managing messaging, and it doesn't stop with the launch of the product. They're continuing to do all this communications throughout. And these are just like simple products that are coming from companies. You can imagine moving to something much more complex like public health and the interventions, and how much more that would be, that would require. But as Michael indicated, if you look at the resources and you look at what's available, from the government in terms of communications, there's not much there. And if you look at, the people, the previous session talked about, people being trained in communications, it requires a lot more. And as Bill indicated, there's a lot of things that you need to do, like community engagement and those things. That all takes money, that all takes resources, that all takes time. So I think the most important thing is we need to elevate public health communications as a priority. And we have to understand that things only work if people hear about it, people understand, the whole adage of, a tree falling in the forest, of whether it actually makes a noise if people can't hear it. Well, it's the same thing here, that we need to make it a priority. And that means actually starting like a national initiative and getting all these different sectors involved and saying, how do we collectively do this? Because this is a systems problem. And we've seen throughout this entire workshop that all aspects of society and systems are involved. So therefore, we need to set up completely new systems to actually tackle this epidemic issue.
That's great, Bruce. Thank you. We're going to circle back to a lot of the key points you just made, Bruce. So thanks for starting us off that way. Julie, you want to go next?
Thanks, Howard. I was fortunate to be at last month's workshop as well. And having been a federal and state official, felt some empathy for the colleagues who were in the room, understanding how much work they have done and how everybody came with the heart to want to be better in the future. So last week was National Public Health Week, April, I call Public Health Month. And so I want to start with an immediate action, which is really one around like letting public health feel a little bit. Because the work that everyone has been doing is I mean, I don't even know what adjective to put on it, but there's, these conversations have been fantastic. I've taken so many pages of notes and asterisk points that I wanted to make in this session, and I had way too many to highlight. But underlying a lot of that is this reality that, one, we're talking about a problem that somebody described as an arms race, and that someone else talked about as having public health be in the perpetual impractical reactive position, at the same time that we've heard multiple examples of successes in public health practice, implementation, guided by science, and also leading future science, and perhaps telling us where we have good enough evidence from community of what works without needing more data to support it. But all that being said, we need to step back for a moment, sort of honor that, and give ourselves a chance to keep thinking about what it means when we are also thinking we want people to trust us, but then realize that in this time of wanting people to trust us, part of the work that happened at the community level is learning from all this and learning from what's happened on the ground and challenging ourselves to step forward to engage communities by even better trusting them with information and to really do the work we're saying we want them to do. And then, building back from what Bruce and everyone else has said, to say this really is an all of society approach. And that's the way I would like us to call everyone else to action, to the solutions. And I'll just stop there.
Jewel, thanks so much. And thank you for your service at the state and federal level. And Demetre, thank you for your service in the White House coordinating the Mpox response. Do you want to make some comments in reaction to Bill's report? And
thank you. So
actions. Yep.
No, thank you so much, Howard, and thanks to everyone. I'll start by saying yes and to everything that Bill, Michael, Bruce, and Jewel said. I think it's all important. I just want to highlight one thing that Jewel said that I think is really important as we approach governmental public health, which is that we approach the way that we do programming using a trauma-informed care lens. And we really have to understand that public health has been through trauma, and we need to sort of approach it in that same lens in terms of how we deal with our communicators and how we go forward. I'm just going to give a quick anecdote that this really brought to my mind. I had the opportunity recently to be in a room where folks who coordinated the response to the Boston Marathon bombing were, and they were asked what was the single factor that made this so coordinated, and the answer was that we already knew each other. So in fact, the former police chief of Boston said that because Boston had won so many sporting games and so many championships, everybody had not drilled, but had actually worked together in a way that created connection. And so when a challenge came, the system was already warm, which is like what I think is the theme of what I'm going to talk about, which is really keeping the system warm. And so looking at sort of governmental public health, it's so important to understand that there are places and strategies that do work in terms of communications, and really supporting that in peacetime ends up being critical in wartime. And so I think looking at the Mpox response as an example, leveraging the HIV infrastructure that included strategies to engage directly with communities very quickly was key. And also innovating the way that you connect to the community. So for us, we were not getting enough individual level response around what we needed to do to nuance the Mpox response. So we put together a workshop made up almost entirely of Black and Latinx Latinx, and other indigenous people who are LGBTQAI+. So directly from the communities that were overrepresented in the outbreak. And that individual level response was used to actually nuance what we were doing and create connectivity. So I go back to my point of keeping the system warm. I think what's so critical is to not lose that component. Just like the folks in Boston, the reason that responses go well is because you know people and you know the systems. So if there's a way to maintain the work that we've done, and specifically maintain the work in the community, because I think it was Michael who said community needs to come first, it's 100% correct. Like you can have biological interventions, vaccines, all these strategies, and if the community doesn't accept them, you'll lag behind. So really identifying ways to keep that system warm, to maintain a group or groups in the community that you can reach to are really important. I'd also like to echo the entire idea of really trusting behavioral science. And so I think that very often we are a part of our own infodemic because we believe in our own that we hear as hearsay. And so where we can build not hearsay, but methodologically understanding how we can improve our delivery and our service delivery with rigorous methodology is important. So saying that people don't want a vaccine because of X is what we've heard is different than we have gone through a methodology, we have looked through social media and other forms of communication, and this appears to be a barrier. We then can create a strategy for response. I also want to say that that although I think public health and risk communication is an entirely whole different conversation, I think one of the things that we need to think about in terms of the work that we do in public health, and I think in also academia, is how can we make risk messaging a part of what we teach our elected officials? So I think that very often it's something that we do very well in public health sometimes, but sometimes when you sort of elevate it and public health interacts with the other components of power that are so important to a response, it gets lost. So during peacetime, do we work harder to make sure that our electeds actually understand risk communication, that they do understand that this is what we know today and what we know tomorrow is different? Because it's easy to make absolute statements, and that's where we always tend to get in trouble and then generate mistrust and confidence issues. So I think at the end of the day, I go back to the Boston Marathon. Now that we know everybody, we need to keep working together so that we can get to the end goal of actually having a nimble system to be able to respond at all levels. It's not just trusted messengers. I think Bill brought this up in terms of looking at industry, but it's also trusted platforms. So for us in Mpox, we were using dating apps. We worked so closely with them, and people listened to them more than they did any public health website. So really thinking about who are the voices, how can we keep the voices, where do people look for their information, and how do they access it? So we can't really make a round, a square peg fit into a round circle. We need to match what people want with what we can deliver. Howard, I'll hand it back to you.
Thank you. Those are great opening comments. So let me just react to some of the themes I heard and stay in the time frame of the next couple of years for now. Demetre, you talked about keeping the system warm. How do we do that when people just want to move on? Exactly a month from today is when the public health emergency ends. So how do we keep commitment and the sense of urgency going? If I can say, I've personally thought a lot about the drills and exercises that we've all gone through over the years. You know, there's some periods where we do that a lot. There are other periods where we just don't do it at all. Is that one way to keep the system warm, or are there other ways to just keep
you know, Howard, I think you said it earlier in one of the sessions when we were looking at community health workers. I mean, the fact that they're getting laid off post-COVID is absolutely ridiculous, considering, you know, there's plenty of other ways to deploy folks with that competency. And, you know, people would ask me, well, you know, what are they going to do after COVID? And I said, the last time I checked, there were plenty of sick people, you know, that we needed to link to care. So, I mean, I think that's, yeah, drilling and practicing, absolutely. But really thinking through what did we build that worked and sustaining it, whether it's through the new infrastructure money or other opportunities, I think is absolutely vital. I think there's also a real need to separate out sort of the, you know, the anti-science, conspiracy, political, all of that noise, which is, you know, huge, from historical distrust and needing to, again, rectify that, and, you know, genuine concerns and questions that are asked. I mean, each of those is going to require different kinds of response, and I don't want to conflate all of that. But I do think keeping them warm, keeping the response and those ties to community warm and active with chronic disease and other infectious disease threats is absolutely one way that health departments can maintain that.
Thanks, Mike. Maybe one more comment on this theme, how to keep the system warm in quieter times. Anybody else want to say more?
So building on that, I'll go quickly, then maybe Bruce will want to say, there are still some areas that aren't warm enough. And so we need to keep that in mind at the same time. Bruce?
Yeah, I'm going to riff on what Demetre mentioned about the Boston sports teams winning all the championships. So people don't stop talking about sports after the Super Bowl is done or after the NBA championship is done. They continue to talk about sports. So similarly, we have to treat public health issues the same way, that it's actually part of life, and keep the conversation going, because there can be a tendency to think, okay, emergency, it's done. Let's stop talking about Mpox, or let's stop talking about COVID-19, but in actuality, these pathogens are still around. So if we can keep that and keep people interested, make the information engaging so that people will talk about it naturally.
Thank you. And by the way, I appreciate the Boston references because I'm a big Boston Red Sox fan. So hope they have a good year this year. All of you said that all sectors have got to get involved. It's not just government. We don't have the resources. We don't have the clout. How do we get other sectors involved, and maybe business, for example? Anybody want to comment on that? How do we get the business sector more involved? I mean, they have seen for themselves that if public health doesn't work, they can't function well. And so hopefully everybody who's a business leader understands the importance of public health more than ever before. How do we get that sector, for example, more involved in all this? Anybody want to comment on that? Or other sectors?
I guess I can continue on the sports theme since we started that. So similarly, why do people talk about sports and think about sports, throughout the season and during the off season? Because they see some type of relevance to themselves, right? So either they've played sports or they feel a sense of community from it. And I think this COVID-19 pandemic has shown and proven that things like infectious diseases and chronic diseases aren't just exclusively health issues or health sector issues that can affect many of the other sectors. And we've seen the impact, right? So you can have a negative impact on all the sectors if something gets out of hand. And it's true also with chronic illness and chronic problems. It's just that this hasn't been raised. People don't understand how much productivity losses there are with the flu, with chronic disease as well. So I think helping other sectors really understand the direct impact on them if the information goes kind of uncontrolled, and as a result we lose our capacity to really control or prevent these problems. And so once someone realizes, oh my goodness, it actually hits me right in my wallet or right in my interest and those things like that, there's naturally we have to make it clear that it's everyone's interest to control misinformation, disinformation.
Thanks, Bruce. Any more comments on other sectors, maybe Bill or Demetre in particular? Or anybody?
I'm just going to add that I think one of the areas is also to sort of work and think with industry creatively. So I feel like one example that comes to my mind is sort of the sort of switch of what's happening with a lot of businesses that have been doing COVID-based testing. And so though COVID tests are changing, there's a lot more antigen home-based tests. Like a lot of those places are thinking like, how can I sort of continue in a universe that works with more chronic infectious diseases? And so many of them are looking toward like, how can I get into the STI market? And so like, I think that there's opportunities there to also build community. And like when you have for instance, some home-based testing companies working to do home-based testing for gonorrhea and chlamydia, as an example, like you have this great opportunity where engagement with the community through the lens of a company ends up being very powerful. And so like you hear about the possibility of like matchmaking. So how can we like better matchmake sort of what folks are looking for that could potentially mean like dollars in their pockets with what we want to see as public health outcomes? Like I think we have the vision sort of in academia and in public health and governmental public health to say, gee, the people over here, these vaccine people really should talk to these HIV pre-exposure prophylaxis companies, because if they work together, they're going to be able to sort of create more force and sort of maintain interest in an area. So I always tend to go back, and it seems to be that I think Michael said this, like there's plenty of work in chronic infectious diseases, plenty. And so the ability to sort of flip from a chronic infectious disease into sort of outbreak response is really, it's like one of the places where you can see sort of nimble activity. So I think companies are a part of that, especially if they are engaged in areas that are biomedical, whether it's a countermeasure or a test.
Thanks, Demetre. Bill, any final comments on this part?
Sure. So, one of the things that we should think about is the balance between trying to get individuals to change their behaviors and getting businesses, universities, other institutions to change behaviors on the part of everybody else. So as we think, for example, about infrastructure changes, can we do better ventilation systems within a building that might in fact filter viruses and protect the next epidemic or pandemic? What are the things that we can do at kind of the institutional level that doesn't depend on individuals changing their behaviors? There's a lot of power there.
Okay, excellent point. This is a really great first part of the roundtable. So let's now move to a longer time frame, let's say 5 to 10 years in the future. And so just dream big. If you had to characterize an ideal system that supports resilience and effectively manages infodemics relevant to a public health emergency, what would it look like? Then what are the structures needed to get there? Anyone want to start off?
Yeah, I was thinking about this, and I was thinking about some of the presenters and their work in monitoring social media, for example. And what came to mind for me was like these public health fusion centers or Homeland Security fusion centers, where you had this monitoring activity and these signals that would then get shared and decentralized. And so I think, there's this tendency, a lot of folks over the past couple of days have had to sort of say, like, there needs to be a centralized sort of federal national approach. And that's true in many ways, because that's efficient. And the capacity to do this is great. But then there also needs to be this decentralized, hyper-local way that action happens. And so we got to figure that out over the long term, because this, like I think it was Joe said, it's getting worse. I mean, you can just open Twitter and see it's getting worse. So kind of thinking through that fusion center model, like what information do we all need, and what are the decentralized capacities we need to respond to it, and who should do that, I think is something we really, again, have to sort out. I used to think there was an easy solution to this, which would be just have 100 people sitting around watching and responding to all of this, but then quickly realized that that's not going to be effective for the long haul. So we kind of have to sort that out.
Thanks, Mike. Other thoughts on what an ideal system would look like in the next 5 to 10 years, and how to get there?
I have plenty of thoughts. So here it goes. So first, starting with the how do we keep this warm part. One of the things that we talked about at the last workshop on improving effective health communication at the federal level was that some of the people in the room who were responsible for dealing with public health didn't actually know each other. It was the first time that they'd actually been in a room together. And one of the things that we focused on at the very end was, how do we create partnerships among people, even if it's informal, discussion groups. And I commented that the most effective groups that I've ever been part of are people of goodwill who trust each other and want to do what's right. There are many of us in state and federal government who match that profile. As some of our perhaps appointed colleagues come and go, the rest of us are lifers, and we're here, and we should be talking with each other and sharing information. And we need to create structures to make that happen. I don't know of a single meeting that we all go to where we're sharing what works. And so that would be one thing I would love to see develop, hopefully sooner rather than later. Another thing is, we clearly need to continue the mission of having public health agencies serve as sources of authoritative information that other people can turn to and amplify. Yeah, we got to do better communications ourselves, but we can't abandon the mission of being the authoritative source of information and, partnering with other people who can get those messages out. We need systems in place that help us understand better people's starting points. What are their concerns and their questions? What are their lived experiences? What barriers do they face in taking action? How do we put those systems in place so that we're collecting that information on a routine basis? And we're doing it in advance so that when something awful happens, we're in a position to respond. And then finally on my wish list is we need to have systems in place that allow us to evaluate, record, and share what's working and frankly, what's not working. In a crisis situation, many of us are working very long days for a very long time. We can't wait for this to be over, and we don't want to think about it anymore. And we'll move on from our current positions, having never written down anything about what we did, what worked, what didn't work, what we would do differently in the future. We need systems to do that. And I'll end with the observation that a lot of the nonsense that's spread during an infodemic is not about false or incorrect scientific facts, but rather about the motivations and intentions of people and institutions. That, many of the messages that are out there aren't meant to inform people, but rather to inflame them. It's about, emotions. It's not about scientific facts. We need to develop a system that isn't primarily focused on simply correcting misinformation or false facts, and are dealing with this bigger issue of trust and motivations. And as a behavioral scientist, I'm willing to be full into that, but it's going to take an interdisciplinary group of us to try to sort all of that out. So that's from me.
Thank you, Bill. That's fascinating. Jewel, Bruce, Demetre, other comments from the three of you on the future, what an ideal system might look like and how to get there?
So as Bill was describing it, I was thinking, okay, what does it look like? Like, what would the org chart do, for example, in civil society? And so based on some of what Bill said and what we've been talking about for the past 2 days, part of this new system will be where we don't have to really wonder about community engagement, because there might be some kind of shared authority in which, like, the first signal that something wrong that we take as critical and worth reacting to actually comes from community, rather than having us declare, oh, we better go tell people now we have a problem. And that's a different kind of a framework to start with, and it goes back to trust. It goes back to empowering and empaneling a workforce that hopefully ASTHO and many others, as we rebuild the public health workforce, will figure out a way to fully, sustainably professionalize people to be community health workers, including public health people who do public health every day, who should be thinking of themselves as community health workers too. But if we can do that, just starting with sort of shared ownership, shared governance, and collective expertise, I think it would carry us a long way forward. It would help us move away from thinking we have to find trusted messengers, because we're becoming trusted messengers together. We can do things we've been calling for over a decade. Maybe first, when you were the ASH, Howard, in terms of really embedding culturally and linguistically appropriate services as part of the information system. And people are nodding, so I'm going to pass the mic.
Thanks, Joel. Demetre or Bruce, you want to wrap this up, this part?
I'll go first. I have a couple of things. So what a great list of future states that have already been listed. So I'll start by saying that. I'm just going to sort of riff off something that Jewel said, which is that really the sort of establishing and maintaining trusted messengers is really important. I feel like that is like one of the parts that it cannot wax and wane. We need to keep building on the sort of universe of humans that we can use and voices that we can use, and how we train them to actually understand the public health nuances. So that really gets to my real pie in the sky, blue sky wish, which is, though I am not a behavioral scientist, I wish that we would prioritize behavioral surveillance. I just think it is so critical in what we do. As someone who's led a lot of responses, what I find very often is that hearsay ends up creating wrong directions. And so if there is sort of methodological fortitude behind what you're saying, like we've done this analysis of social media, we've done this focus group, we've done X, Y, or Z, and what we found is that we're seeing this, as opposed to we're hearing through hearsay that. So I always put up, talking about keeping the system warm, models that work. And so in HIV, there's a national HIV behavioral surveillance system that goes on a cycle every 3 years, looking at priority populations, whether it's people who inject drugs, men who have sex with men, or other heterosexuals, where we actually do get behavioral data about the interventions that we do that influences how we go forward. I think another great example that happened at CDC, and I think you heard from Catherine Willem a bunch yesterday, is that, actually like having methodology behind confidence on preventative interventions, whether they're vaccine or other, so that we can actually create a strategy that's based not in hearsay or in limited data, but more national representative data. So I know that that's a really big ask, but if we're talking blue skies, really creating a national behavioral surveillance system that is agnostic to infectious disease could potentially also address non-infectious diseases as well. That's a big pie in a big blue sky.
That's wonderful. You got so much touch points to refer back to, Demetre. Thank you. Bruce, you want to wrap up this part?
Yeah, I think it's important that the S word is being mentioned frequently throughout this workshop, and by that I mean systems, because we have to understand that I think in the past there's been a lot of band-aids, a lot of patch solutions, and those don't work because you don't really know what the ramifications might be if you just start like these one-off solutions, but really creating this new system. And I agree with all my colleagues here in terms of making sure that people are actually, and I want to say not just part of the system, but they're actually, all the communities are actually baked in as decision makers within this system, rather than, it's not a one-way thing where like, you when you engage a community, it's not like you tell them or find out what they want. They're actually part of the decision making, and all of the things that were said. But in addition to that, I think several things. So one is we need to be a lot more proactive about the platforms, technology, and communications methods that are used. So why can't we actually be creative and innovative, put in the research to find out what might be the communications tools in 2 years, 3 years, 5 years, and get ahead of the curve and actually use those to advance positive, truthful information, rather than reacting. Like we suddenly find out, oh my goodness, what's happening on Twitter or what's happening on social media, and then we have to react. Instead, sort of being more anticipatory and leverage technology and understand the communication is not going to be the same now, or not going to be the same in 3 to 5 years as it is now. So can we come up with some of those new technology? Two is actually develop a new field. I mean, we know we have the pieces, like we have journalists, we have people doing communications, but we need more hybrid individuals who really understand all aspects of these things so that can help bring people together. If you look at historically, there's been new disciplines that have emerged, like industrial engineering emerged because there was a need to merge, quantitative engineering with management sciences and those things like that. Similarly, we need more people who can cross these different fields. So that means, bringing up new training programs, helping people, encouraging people who would actually like to step across different silos rather than stay within silos. And then finally, we really need to understand this whole system, how everything fits together, like map it all out, and then come up with a national strategy on how all these things will fit together so that we can be a lot more proactive. And this way we can have these mechanisms, as Bill mentioned, to regularly keep people together. And one last thing, I mentioned sports, entertainment's another example. These are stuff that people talk about every single day, and they get excited about talking about these things. We don't necessarily have the same thing with health and science. Health and science is sort of viewed as, oh, it's this like, oh, maybe an egghead thing, or, oh, I'll have to deal with it if I have a symptom. But it should be part of the national conversation throughout. And so that people are excited about talking about these things. So they actually have base knowledge and understanding of these things. So we don't wait until we have to push information out there. So how do we find creative ways to integrate health and public health into entertainment, health and public health into, you know, all kinds of aspects of society that we regularly talk about these things, and that requires a system in place as well.
That's great. That's great. Very broad, very cross-discipline, fascinating conversation. Let's just spend just a couple of minutes on a tech issue. How do we plan for the future where technology is constantly evolving? You know, it's fascinating to hear from our colleague in Canada how they used AI for monitoring and tracking in a very positive way, but there are also a lot of concerns about the fast evolution of AI. I just want maybe just a couple minutes on this. Anybody want to comment on that or evolving technology in general?
I'm still trying to work on data modernization for surveillance, Howard. I can't even deal with this.
And I'm living with a suggestion that someone gave us at my med school last week, which was, we all need to get more familiar and knowledgeable about it, so we even know how to answer that question, Howard.
Yep. We're all in that boat, I guess. Anybody
So
else?
I'll weigh
That-
in and
That was
say-
over my head.
So I'll weigh in and say, yeah, the technology is rapidly changing, but what does not change is human nature. And you know what we really need to figure out is kind of where people are, and sort of match that up to the capabilities of the changing technology. People are on different platforms. They're going to move to different platforms. Where do we find them? How do we target messages to people on those various platforms? How do we benefit from ChatGPT and other technologies? Can we, in fact, train them on responsible information, on authoritative information, so that when they are queried, they actually return decent information rather than nonsense? I think if we could be involved at that level, we could actually improve these technologies.
Thank you.
So I can comment, since I've been in the AI modeling computer space for the past couple decades.
Oh my God.
You know, public health is behind the times in terms of integrating tech and AI. If you think about it, you know, you can go through all public health training without a basic tech course. You know, if you look in finance, for instance, you go through business school, you know, everyone who goes through business school learns Excel. They learn some degree of like using, you know, operations research as part of their training, et cetera. So at least they have familiarity with those things. Whereas we don't really necessarily have the equivalent in public health and health in general. You can actually go through a lot without becoming familiar with this. That doesn't mean everyone needs to become an expert, but it makes a big difference if you are actually conversant and fluent and understand what's meant when you use these different terms. And actually, when you're steeped in the field, it's not super complicated, but it's just a matter of there's a whole new, you know, whole different jargon and those things like that. So we have to integrate it a lot more into public health so people understand, you know, when you, you know, I can't tell you the number of times people say, oh, can you go AI the heck out of this? Like, no, that's doesn't work that way. There's not like an object where you'd say, okay, I've AI'd it. It actually incorporates many different types of technology. So if we can help people understand better what these things mean, I think we have so many bright and very insightful people in public health already. It's just a matter of getting them a lot more familiar with the technology so that they can then also inform the technology and come up with algorithms and approaches that are actually beneficial for public health. You know, they always say that technology is neither good nor bad. It's how you use it. So if we can use it in a positive way, I think that's the real approach.
Good, Chris. Great that you have so much knowledge here. Go ahead.
I think the one thing I would add to that is not necessarily technology, but technology governance and coming up with some right way to manage all of this, you know, and setting policy where, you know, again, you can balance free speech with medically accurate, evidence-based messaging. And how do we do that? So it's not this Wild West. And, you know, hopefully in 5 or 10 years, we'll figure that out. It doesn't seem to be working now, but it's certainly something that concerns me a great deal.
Yeah,
just want to add something to what Michael said, if that's okay. Sorry, Howard, which is also that, and though I can't speak to AI specifically, though I think what's really important is also understanding that when public health is implementing new technologies and new strategies, especially in surveillance, that it's really important to have community engagement so that there's an awareness around that. So I think that there's like examples in sort of my normal universe, which is HIV, where there's an acceleration in the use of molecular surveillance data to identify clusters of infection that really has created a lot of controversy within the HIV community. And so I think that really thinking that when you do the work, that engagement is a piece of it as you include new strategies, whether it's in a data modernization sort of scenario or if it's using AI. People really want to know how their data is used, and trust is built by transparency, which I think should be on my tombstone. But trust is in fact built by transparency.
Thank you. I know a couple speakers today talked about working more closely with social media companies, and they have resources and they have a lot invested to get this right going forward in terms of tackling the infodemic as well. So that's another potential partner going forward. So we got 9 minutes left. I wonder if each of you want to make a final takeaway comment or suggestion for the future. I don't know who wants to start. Bill, you want to start again? And thank you again for sharing that past workshop. And it looks like you got a lot more work ahead of you. So thanks so much.
I think we do. I'd like to end with thanking everybody who's been involved in dealing with COVID over the last several years. And, I know we've said that a lot, but there are a lot of people out there who've literally given their lives to deal with this. And we don't give them enough gratitude and grace.
Thank you. That's very humane, very touching. Thank you, Bill. Who wants to go next?
Well, I certainly appreciate that, Bill. I want to extend my thanks, to all of you for this workshop, but also our state and territorial health officials. There's a lot of comments made that, from a deficiency point of view, over the last couple of days about what public health can't do. And when we think about some of our successes, I think they're tremendous. So I want to echo that. But I would also say that this is not a public health problem to solve. This is not a governmental problem to solve in isolation. And I think one of the things that you demonstrated with this workshop was how many people are interested in this, what the various opportunities are. And I think this idea of creating a community of practice that really brings these folks together is what needs to happen next, because we're all learning as we go on this, and there's so much expertise. But in looking at the agenda, I didn't know 89% of the people on the agenda. And I run a National Association of State and Territorial Health Officials. So I just think it's all opportunity, but we have to be realistic in the threat we face, which is monumental.
Thanks so much, Mike.
So
I just can't. Oh no! After Jewel. Sorry, Jewel. Go ahead.
Well, I try to live in the world of opportunities. So a few of the other take homes for me from the past 2 days included that we need to avoid hubris, because we're really hoping that the information ecosystem becomes the right one. But as someone else said yesterday, even when people follow the science, that can lead to different policy considerations. And so we need to be able to accommodate that as well. And along the way, as we plan for the short and long term, we need to be sure that we don't create new marginalized communities as we try to build, this collective group that's going to help move health and well-being forward through the vehicle of health information. I'll just stop there.
Thank you. Thanks, Joel. Demetre,
I'll just end where I started, which is, again, I think that one of the important sort of comments and lessons of the day, and I think Michael sort of put it together as a community of practice, is that that relationships matter. Public health is about people, and people use the information. So the more that we can identify ways that we can work together and maintain relationships and evolve them. Again, like a lot of the people on this call I've never met, so it's really exciting, and it sort of makes the point that sort of venues like this that creates connections and creates the opportunity to actually have that same experience of Boston during the bombing that says we were okay because we all knew each other. I feel like that's really really important. I think we've gone a long way. And I think that we're the system that we need to keep warm. But as Bruce said, I think we really need to remember that systems need to be addressed by people who understand them. And that means not just people in public health, as Michael said, but also people beyond, and sort of thinking about who has skin in our game that we need to bring into the mix, so that we make sure that we move forward in a way that shows that public health problems are all of society problems and not just something that's related to a health department or the CDC. Thanks.
Well said. Bruce, you have the last word?
Yeah, well, thanks. I think all great points and insights. And again, I agree. It's yes and. And I think it's easy with all this misinformation and disinformation to get discouraged and kind of take a darker view of society and humanity. But I think there's a lot of positive things that came out of this pandemic. If you look around this room, and not just this current room, but throughout the past 2 days, you're talking about a lot of different people who volunteered a ton of time, a ton of effort into battling misinformation and disinformation throughout this pandemic. Many cases, it's completely volunteer time, in addition to their normal responsibilities, et cetera. I think that says a lot about, one, humanity, but also the strong interest in making sure that the truth gets out there. And so all of this was done without like a real system in place to tackle mis and disinformation. So think about what's possible if we actually do put these systems in place. If we actually have the resources and the effort and the channels to do all these different types of things. Just the talented people within this workshop, and then also more broadly, all the people who've spent hours of trying to combat misinformation and disinformation. You can really leverage all these skills and talents if there's a real system in place, and we can tackle these things together. I think there's, we can be more proactive. We can really get ahead of the curve. And I think if we view this on a positive light and say, this is all doable, I think we can accomplish a lot of stuff, not just in the next 3 to 5 years, but the next decade or several decades from now.
Wow, what a wonderful way to end. Thank you all. What a fantastic roundtable. So I want to thank all 5 of you for your insights and your commitment and your future orientation. So